So the heart. We always talk about the hypertrophic cardiomyopathy associated with it. And the question then, and it's been a burning question, and actually it was, in my mind, they had a study that was only recently done, a few years ago, but they looked at actually the wall thickening and what happens to that wall thickening after treatment. Because you've got these cats that, yeah, they do have myocardial thickening, and then the owners, and you say, well, this could be hyperthyroidism. The owners say, well, what's going to happen after treatment? Is that getting better? Is that going to get worse? Is it going to stay the same? So let's talk about that. In terms of that left ventricular wall thickening, true or false? Left ventricular wall thickening resolves in all hyperthyroid cats, made euthyroid or hypothyroid by I-131 therapy. This one might be a little bit of a stumper, huh? So, not really, huh? Everyone's got it. Right, it is absolutely false. And that's, I mean, the word all is a giveaway on that. But these cats, in the study that was done, these hyperthyroid cats, actually after treatment, some of them progressed on. So it's not always due to the hyperthyroidism. Some of them actually have HCM primarily. Some cats that really they thought it was due to the hyperthyroidism, they did get some thinning of their wall and normalization of it. All right? But, and to give it away, but you'll have the confounding factor that later on after hyperthyroid treatment, you're going to have hypertension a lot of times, systemic hypertension. And the majority of cats that are treated, actually hypertension associated with hyperthyroidism, there's less cats that are hypertensive before treatment than after their euthyroid. The reason is that the kidneys play a bigger role in hypertension than the thyroid does. So checking them before and then assuming that they're going to be okay afterwards, it's false. Because they will become hypertensive afterwards, and if they have wall thickening, that may take over the cause for the changes. So once the kidney stuff takes over, then they get the wall thickening continued. Does that make sense? So about 10 to 15% of hyperthyroid cats develop heart failure. That's why we do a cardiac ultrasound prior to treatment, because we have had a few cats come in with pleural effusion, and we want to make sure they're not in failure prior to putting them in the room. Once they go in there, they can't come out for 5 days. And we can treat them, but we can't pull them out. So the next one is ECG abnormalities associated with it. The arrhythmias, the tachycardias, the increased R wave amplitude, and it's going to be the question of all ECG abnormalities associated with hyperthyroidism resolve following successful treatment and return to a, should say, euthyroid state. This is one of those all questions that actually is not false. Based on the literature that's been out there, they have all gone back to not having the changes associated with hyperthyroidism on their ECG. So they will normalize. So the ECG, yeah?
How do you determine whether it's primary or secondary cardiomyopathy?
Yeah, that's a good question. And so this is based on that literature, and so I mean it's a little bit tough, but everything I got to write in here is based on all the literature that's been done. But in the literature on the studies, everything that's been shown on these ECGs has been resolved. So if you see some ECG abnormalities, you can kind of tell the owners, you know what, these will probably resolve with hyperthyroid therapy. But if you see echo changes or there's a result of echo changes, I would not be so cavalier and say these will go away, because that cat may have something else going on. Or afterwards, it might develop systemic hypertension and then have a progression. So don't really put yourself out on that one. All right. GFR, glomerular filtration rate. With I-130, with hyperthyroidism, GFR is increased, and that plays a big part in things. It plays a part in lowering the BUN and creatinine. It plays a part actually, and we'll get to it, about T4 levels. A lot of things are played in there. So to understand what's going on, based on the literature, hyperthyroidism increases glomerular filtration rate by 150 to 200%, 50 to 75%, 25 to 50%, or 75 to 100%. So how much better are these kidneys functioning with hyperthyroidism? So I think it's kind of surprising to know that they actually will double their function with hyperthyroidism. So those cats that are sitting there right at the borderline, BUN and creatinine, urine-specific gravity, not isoscenuric, but 1020, 1025, I can tell you every one of those cats has a component of renal insufficiency. I've never seen one of them that didn't have a rise in BUN and creatinine post-treatment. So you gotta be cognizant of that these are the values GFR is gonna drop. It's gonna drop within the first month, and then you're gonna start to see, not always azotemia, but let the owners know beforehand, you're gonna see a rise in the BUN and creatinine. I don't want you to be worried about it. And so if they're at 30 on the 35 on the BUN, post-treatment they're gonna be 45. They're just gonna change that way. So a lot of them have underlying renal disease. It's a common thing. They're cats, they're older, okay? So the problem is that with the increased GFR accelerates renal damage. So if a kidney that was gonna last 2 years in a hyperthyroid state, it only lasts a year. It's running the motor at 10,000 RPMs. It can't sustain that type of pace. The decreased GFR associated with I-131 treatment or the methimazole trial will unmask that renal disease. Not always, but for the most part, we get a good idea of where they'll be after treatment. And that's probably the number one, that is the number one reason we recommend the Tapazole trial, is to see where their kidney values are going to be afterwards, so owners understand what they're in for, okay? Because it's not that these cats are not candidates for treatment. It's, I don't want these owners to be surprised afterwards and go, I wasn't expecting this. As long as they understand, they know the expectation, and they understand the risks, and they assume that, all right, we'll deal with that when we have to, they're happy afterwards. And especially if it's one where it's either the cat's going to keep starving and wasting away, or the owners are going to give fluids and they're okay with that, or the cat's T4 drops so low that you end up having to give siloxane as a pill to bump it back up. They're actually okay with that. And I'll tell you that methimazole is a bad drug. Siloxane is not really a bad drug. It doesn't have the side effects. So I'd rather see a cat go low and then bump back up than stay on methimazole. And I'll get to it, but let the cat out of the bag on that. There was a study done that looked at 4 factors for hyperthyroid cat survival. First one was methimazole therapy. Second one was underlying renal disease. Third one was cats that got I-131 therapy, and the fourth one was age. And age we know, I mean, the older the cat's not gonna live as long. So that was just a no-brainer. But renal disease, any type of renal insufficiency in terms of being somewhat clinical, like stage 2, starting to PUPD, all of that, 2-year survival. Methimazole therapy, no renal disease, 2-year survival. I-131 therapy, even if they were on methimazole first and then went under I-131 therapy, 4-year survival. Methimazole is a bad drug. It's never meant to be a permanent treatment. But so it does reduce lifespan, and a lot of the animals get sick on it. So that being said, we use it to unmask renal disease. And if the cat's doing well and the owners don't want to go forward, then I'm happy to let them stay on it. But they have to understand what they're in for. That's the main thing. Reason number 2, concurrent disease and lymphoma. We're dealing with old cats again. So they have other diseases. A lot of times we'll put cats on methimazole, have you do it, cat's still losing weight, something else is going on. Unless they're now started vomiting, and then we talk about going to transdermal. If they're still losing weight and vomiting, something else is going on. Look elsewhere, all right? Especially if the T4 gets in the normal range. Blood work, and I just had a cat, Dr. Deffenbaugh, we were going back and forth. I frustrated the heck out of her with this because, again, literature, they looked at this in 2007 out of JVIM, looked at about 130 cats. Every cat had an elevation in liver value. None of them had underlying liver disease. The highest value was 684 on that cat. Dr. Deffenbaugh had a cat, came in for treatment, ALT was 1,000. Said, we gotta look at this. We did an aspirin on this liver. it came back as thyrotoxic induced change. Next time, put on antibiotics and some hepato support. Next liver value, 1,300. Scared the hell out of me, I gotta tell you. But talked with other people and everyone said, you know what, it's probably due to the changes. I'll keep you posted on that. We'll see. Because when it gets that high, I'm worried something else is going on. But overall, so far, I can't refute what's been published, which is they don't have liver disease. If they're hyperthyroid, it's due to thyroid toxicosis. Okay? The other interesting thing is that the Alk Phos is actually the bone isoenzyme. It's not the liver one, it's the bone. So there's an increase in metabolism of bone and turnover. And that's going to play a part because later I'm going to talk about these relationships. They actually have a little bit of hyperparathyroidism. Their ionized calciums are a little bit low. So their whole body is kind of changing the way it's moving through their minerals and what's going on because of the metabolism, most likely. So that is not liver related. And we all know that Alk Phos in a cat's terrible if it's high because it's a 6-hour half-life versus a dog, which is a 72-hour half-life. So if Alk Phos in a cat is up, that's bad news. But in this one, it's the bone isoenzyme. They have a higher ammonia, a lower cholesterol. And then this was just a great paper because dealing with this and looking at those, being able to say, you know what, there isn't really something going on there. We can kind of let that go. Diet, there's been talk over the years about using diet to maintain these hyperthyroid cats. They talk about what happens with excess iodine or iodine deficiency, short-term, long-term on their T4. So I'm going to throw this out here. I'm going to throw that out too. So alteration in dietary iodine intake can affect the cat's T4 levels in the 1, long-term, or 2, short-term. Kind of split on that. And it's interesting, it's short-term. In the first month, they'll drop down, but then they'll come right back up on that. So limiting their diet, iodine intake, doesn't help long-term managing them. Okay? So if the owner asks, people ask these questions. Well, can we limit the iodine? Yes, you can for a month. It's going to help. But after that, and it's only really going to be affecting that T4 level because there are other things that these overactive thyroids are secreting because what we've seen is you can get these guys T4 in a normal range with methimazole therapy and their other changes continue to progress. So there's other stuff that has to be, it's being secreted.